снять надо, ну ладно. Hi, my name is Alona. I'll be performing head to toe assessment on you today. I'm an NP student, so we'll get started. I'm going to have you stand up and look at the chart across the about 20 feet away from you. Close one of your eyes and read the smallest line you can, please.
ESTPNL.
Okay, so in the other eye, please.
ESTPNL.
So bilateral eyes, 20/20 vision, left and right eye are both 20/20. Go ahead and sit back down. Next we're going to be looking at color. About 14, go ahead and tell me what color this is.
Green.
And this.
Red.
And that is appropriate, that is correct. Next we're going to be assessing your near vision, so hold this about 14 inches away. And read the smallest line you can, please.
TOOFDZS.
No.
C.
Okay. One more time, please.
TOFDZC.
Okay, 20/15 vision. Binocular. I'm going to be looking at your eyes. Go ahead and turn towards me. So looking at your eyes, sclera is white. There is some vasculature throughout. Conjunctiva is pink. I don't see any pallor. Pupils and the iris is symmetric on both sides. I don't see any extraocular movements. Iris is a green color. Pupils are black, which is appropriate. Next, we're going to be looking at the corneal reflex. I would take a clean sterile gauze and just touch the cornea there, and then they should blink, and that would be a positive corneal reflex would be present. So I would say corneal reflex is present. Next, we're going to be looking at your optic nerve. So I'm going to go ahead and turn off the lights here. I'm going to be looking at my pen light. So just look at me on my nose. I'm going to shine the light in. Pupil constricts from 5 to 3. Pupil constricts from 5 to 3. With consensual response bilaterally, which is appropriate. Cardinal field of gaze. Just tell me when you can see my fingers.
Yes. Yes. Yes.
Okay. Next, we're gonna be looking at the oculomotor, trochlear, and abducens, which I also just assessed with the EOM. Go ahead and look here. Pupil converge and accommodate bilaterally. Next, I'm gonna have the light off. We're gonna perform the ophthalmoscopic exam. Make sure this is working. I'm gonna come in, so just keep looking straight. Yep, I'm gonna come in at about a 15-degree angle. So I'm gonna be looking at his left eye, using my left eye to be looking. Coming in, red reflex is seen. The retina and the vasculature is visualized and it looks appropriate. Next, I'll be looking at your right eye. So I'll be using my right eye. About 15 straight at me. Red reflex is noted. Coming in, retina is visualized and the vasculature is also visualized, which is appropriate. We're going to be looking at your face. Just look at me, yep, straight. There's no facial droop. Skin is appropriate. I don't see any hypopigmentation. Facial growth is facial hair growth is appropriate as well. I don't see any nevi on the face, and there's no droopiness of eyes or the mouth. Next, I'll be looking at the distribution of your hair. It is thick and brown. And then we'll turn on the light to look at the scalp. and then no alopecia present, looking at your scalp, no dandruff present, no infestations or lesions present. We'll look at this side. Okay, next we're gonna be looking at the trigeminal nerve. So I'm gonna go ahead and do the sensory. Just tell me if you feel this.
Yes. 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 Yes.
Good. Next we're gonna be so clench your teeth. Okay, perfect. So we're clenched, that's the motor part of the trigeminal nerve. Next we're gonna be looking at your facial nerve, number 7. Go ahead, smile, puff your cheeks out, and then raise your eyebrows, which is appropriate. I'll be palpating your sinuses, frontal. Any pain? Maxillary pain?
No.
And then we'll go ahead and percuss. Okay, there's no issues with the sinuses. Next, we're going to be assessing the cranial nerve 1, which is the nose. We're going to use, go ahead and close your eyes. So do you smell?
Alcohol.
Yep, that is correct. So the cranial nerve 1 is appropriate. I'm going to be looking inside your nose. Go ahead and lift. There's no discharge, no polyps or deviations that are seen. Next, we're going to be looking at the acoustic nerve. Do you have any hearing problems?
No.
Okay, I'm going to perform the whisper test. So I'm going to just whisper something in your ear.
Cat. Dog.
Okay. Next, we're going to be doing the Weber test. So just tell me where you hear both sides or just
Both sides.
both sides. So lateralization is appropriate. Next, we're going to perform the Rene test. Just tell me when it stops.
Stop. Stop.
Okay, so I'll perform the same thing on this side. So hit it, and he would tell me when it stops, and then bring it to the ear. This is where it should be twice as long, so air conduction is greater than bone conduction. Next, we're going to be looking at inspecting your ears. We're going to be seeing for otitis externa. I'm just going to pull the auricle up. Any pain here?
No.
Up and any pain here?
No.
Okay, great. And then otitis media. I'm going to be pressing here. Any pain here?
No.
Any pain here?
No.
Good. Next, we're going to be changing and looking at the tympanic membrane. Tympanic membrane is pearly white. I don't see any bulging or erythema. The conal light is at 8 o'clock. I'm gonna come in on this side. The tympanic membrane is visualized. It is pearly white. There's no erythema or bulging, and the cone of light is visualized at 3 o'clock. And bilaterally minimal cerumen is noted. Next, we're gonna be looking at your. So I'm gonna be looking at your lips. So go ahead and turn towards me, please. And your mouth. We're gonna be looking at your lips. Your lips are pink. They're symmetric and moist. I'm gonna go ahead and look in your mouth here. Looking at your mucosa and gums. Go ahead and show me your gums. Good. It is moist. I don't see any lesions or any protuberant or any lumps or bumps or anything like that. Any tumors, no tumors present. Next, we're gonna be looking at your vagus nerve. So go ahead and say ah. And I will be pointing the light. UV light is midline and it falls and falls within the plate. Next, we're gonna be glossopharyngeal, which is your gag reflex, which is appropriate. I'll just verbalize that. Next, the hypoglossal nerve. Go ahead and turn so we can see. So stick your tongue out, and then left and right. So hypoglossal nerve is intact. There's no extra movements. It is all symmetric, and tongue is midline. Next, we're going to be palpating the trachea. It is midline. We will also palpate the thyroid. I'm going to be looking for the cricoid cartilage, the hyoid bone first, which is about here, and then going down, we're going to hit the thyroid cartilage, and then we're going to hit the cricoid cartilage right above the cricoid, and the thyroid cartilage is the thyroid gland. Go ahead and swallow. Swallow. And I did not palpate any growths or tumors on there, which is appropriate. Next, we're going to be palpating your lymph nodes. We're going to be anterior auricle here in front of your posterior auricle. Next, we're going to be coming to the occipital, posterior cervical coming down, inferior or superficial cervical, supraclavicular, mandibular, and supramental. And there is no lymph nodes palpated. Next, we're going to be auscultated for carotid bruits. I'm going to be using my bell for that. Okay, look straight, please. No carotid bruits auscultated. Next, we're gonna be looking at your lungs. So we're gonna have your shirt off, please. Mm-hmm. Sit back down. Thank you. Next, we're gonna be looking at the symmetry here. Everything is symmetric. I don't see any deviation. His rhythm, as I counted before starting this, is 14, unlabored and regular, and AP diameter is 1 to 2. Next, we're gonna have you turn so I can we can see what we're doing here. Next, we're gonna palpate. So just tell me, say 99.
99. 99.
Okay, so the sound is symmetric throughout. There's no dullness to it, or there's no increased sound. which is appropriate. Next, we're gonna perform percussion, and then resonance should be heard throughout. Resonance is heard throughout the lung field interiorly. Next, we're gonna be auscultating your lungs here. Good breaths. Clear lung sounds auscultated throughout. Next, we're gonna be looking at your back, so go ahead and turn. So to the camera, please. To the camera. Yep, just like this. We're also looking at the symmetry, and everything is symmetric. Skin, both sides, anterior and posterior. I see some nevi here. They look okay, looks like some sunspots there, but otherwise there's no hyper or hypopigmentation present on both sides, which is appropriate. Next, we're gonna, same thing, so tactile firmness. Have you say 99, so you can see the camera here. Go ahead and say 99.
99. 99. 99.
Okay, sound is symmetric throughout. There's no dullness to it, which is appropriate. Next, we're gonna be percussing. Okay, resonance is percussed throughout the lung fields bilaterally. We're gonna move on to auscultation. Take good breaths in for me. Lung sounds are clear. There's no adventitious sound throughout the lung field posteriorly. Next, we're gonna be looking at the CVA. Let me see. Any pain?
No.
Any pain?
No.
Okay, so that is appropriate. You shouldn't have any pain there. Next, we're gonna auscultate while you're saying E.
E.
Once I'm listening, which is checking for agophony. Go ahead and say E.
E. E. E. E. E. E.
Okay, sound was bilaterally symmetric, and there is no dullness to it, which is appropriate. Next, we're gonna be doing, so go ahead and turn around, please. We're gonna be, I'll be palpating your carotid pulse. Carotid pulse is 2+ bilaterally. Next, we're going to be the radial pulse. 2+ bilaterally. the brachial pulse. Mm, brachial pulse. 2+ bilateral. The pedal pulses, dorsalis pedis. 2+ bilaterally, and then the post-tibial here. 2+ bilaterally. Next we're gonna be, looking at your heart. So I'm gonna have you please just lay back. Change the position of the camera. Sure everything looks good, okay? Okay, so next we're gonna be inspecting first. So I'm looking any abnormal symmetry or any heaves or any palpations or anything like that. I don't see it. And again, the skin is unremarkable. There is no hyper or hypopigmentation. Next we're gonna go ahead and auscultate the 4 points. So apical, about second intercostal space. Just here. The pulmonic, where S2 is heard best. The Erb's point, tricuspid, and the mitral, where S1 is heard best. S1 and S2 is auscultated on all 4 points. Next, I'm going to be using the bell to listen for any murmurs. So first we're going to start out with the Erb's point. So Erb's, tricuspid, and then mitral. No murmurs auscultated throughout the 3 points that were auscultated. So next we're going to be looking at the PMI, the point of maximal impulse. Let's get some lighting here. So I would say point of maximal impulse is about at the fifth intercostal space. It has a, with a single outward pulsation, impulse, and it looks appropriate. Okay, next we're gonna be looking at the abdomen. So first we're gonna auscultate. Inspection is first, of course. So looking at the abdomen, I don't see any pulsations or anything like that. Everything looks appropriate, skin looks appropriate, like I said earlier. Next we're gonna start with auscultation. We're gonna auscultate, making sure. Normal active bowel sounds are heard throughout all four quadrants. Next, we're gonna be assessing the arteries. We're gonna be using bell here. first aorta. There's no bruise auscultated. Iliac. The renal. And the femoral. No bruise auscultated throughout all the abdominal arteries. Next, we're gonna let's see, do the liver. Oh no, let's percuss first. So we'll be percussing all quadrants. So tympani is percussed throughout the abdomen, which is appropriate. Next, we're gonna be assessing the liver span. I'm gonna be starting percussing down until I hear dullness. So one hand here, please. Okay. And then one hand here. We're gonna go ahead and measure. It is about 8 centimeters, which is appropriate for an adult patient. The scratch test I still have to practice on. I still have to see exactly how to do that, so I'm going to skip it here, but I will be prepared for the final checkoff. Next, we're going to be looking at the spleen. I'm going to be percussing, so lie on your right side, please. Okay, mid-axillary line between the 6 and 10 rib. Here we 10, 12, so about 5th, 6th, so from here to here. There's no dullness heard, which is appropriate. That means there's not, there's no enlargement in the spleen. So go ahead and turn on your back, please. Thank you. Next will be light palpation, going into more intense palpation, deep palpation. Any pain or tenderness?
No.
So just light palpation here.
No.
Pain, tenderness. No. Looking at the facial expression as well, and I do not see any guarding or anything like that. Next, we'll be doing a deep palpation, so just a little deeper.
No.
And I'm feeling for any tumors or anything like that, or in exactly with the pain as well.
No.
No, and then next we're going to be going into the inguinal nodes. And there's no nodes that I can feel that are hard or abnormal, which is appropriate. Next, we're going to be doing the Murphy sign, which checks for cholecystitis. So take a big breath. Any pain or tenderness?
No.
So that is negative. Next, we're going to be McBurney's sign for appendicitis. Any pain? Okay. So that is negative. And then the rebound tenderness, Bloomberg sign. If a patient was having pain somewhere, I would just perform it there. So I'm going to rebound tenderness.
No.
Slow. And then I just quickly release. Good, so that is negative. Next we're gonna be looking at your Brzezinski. So go ahead and lift your, any pain or tenderness?
No.
Okay, next we're gonna be looking at the Koenig sign. Any meningeal, any pain with this?
No.
Good, good. Okay, so we're gonna be having you stand up, please. We can change the camera around again to be fully appropriate. And then put the stool here. Okay, so I'm gonna be looking at your, okay, double checking. You can stand up, please, for me. Thank you. So be looking at the skeletal system. So just looking at your bones. They're all symmetric. I don't see any tumors anywhere from head going down. They all look equal in size on both sides. Looking at your muscles, again, they look symmetric. I don't see any tics or anything, or any extra movements, which is appropriate. And then your skin, looking down, there's no hyper or hypopigmentation. There is some nevi here and there, but not too much. They look appropriate to me when I was assessing. Next, we're gonna be doing range of motion. We're gonna be looking at your shoulders. So first, we're gonna be doing the abduction, adduction. Okay, perfect. We're gonna be internal and external rotation. Perfect. Next, we're gonna be abduction, flexion, internal and external. Oh, 1 second. Okay, abduction. This is flexion. Go ahead and extend. So those are the 6 motions. Next, we're going to be looking at the spine. So lateral rotation. And then just with the rotation, yep, lateral rotation. And then go ahead and flex towards me, down your toes, and then extend to the back. Perfect. So scoliosis, I'm going to have you, let's turn towards the camera here. Go ahead and touch your toes. So I'm looking for a symmetric and midline spine, which is what the patient has, so which is appropriate. Okay, we're going to be lying again. Oh, this is going to be, okay, so we're going to be lying. Go ahead and lie back. Okay, we're going to flex your hip and flex your knee in as well. Extend your hip, extend your knee. Flex your knee and flex your hip. Extend your knee and extend your hip. Abduction is outward, and adduction is inward, bringing it in. And next, we're going to be rotation. So go ahead and bring those internal, and on the other way, external rotation of the hips. We're going to be plantar flex and dorsiflex. So go ahead and bring those. That is dorsiflex, plantar flex, the other way. Perfect. Next, we're going to be having to sit down again. We're going to be assessing your strength. Strength. Okay, so go ahead and flex, push. Okay, and then pull towards me. Perfect. And then lats and deltoids. And then we're going to just rotate. Good. That is appropriate. And I didn't miss the MCL, LCL, ACL, and PCL, which I have to work on. So I will be studying that this week. Next, we're gonna be gripping my fingers here. Grip, stronger grip, bilateral. Good, thank you. Next, we're gonna be looking at the hip strength. So I'm gonna have you push up. Perfect. Pull down. Okay. Same thing, push up. Good. And then pull down. And grading those muscles, it is so far they've been 5 out of 5 on all the muscles I have assessed. Next, we're gonna be looking at the knees. So go ahead and push out. Good. And then push in. Push in. And then push out. Knee strength, bilateral muscle strength is 5. We're going to be looking at your toes. Flex them up, flex them down. Okay, those are muscle strength of 5. Next, we're going to be looking at your deep tendon reflexes and rating them as well. Sorry, my battery thing. Okay, so next we're going to be looking at the reflexes. We can start out with the sitting here. It's a little easier for my patient. We're going to be looking at the patellar reflex. Okay, so that is appropriate. The grade is 2. Go ahead and sit back down. It's a little easier for us. So the bicep here. Okay, so that is also bilateral bicep reflexes +2. We're going to be doing the brachioradialis here. I'm going to be holding my thumbs in and then feeling the jerk, which is strength of 2 bilaterally. Next, we're going to be the Achilles here. Which is appropriate grade of 2. Next, we're going to be looking at cerebral testing, coordinations. We're going to have you rhythm and rate is appropriate and smooth. Okay, and the fingers to thumb test, go ahead as fast as you can. Rhythm and rate is appropriate and smooth. Next, we're going to be looking at the heel to shin test. Sliding down, leg coordination. It is smooth and symmetric on both throughout. Good, smooth and accurate. I'm gonna have you stand up and we're gonna assess your gait, so come towards me. Just come towards me. Gait is appropriate. Okay, let's get back. Next, we're gonna be looking at tandem walking, so heel to toe, which is appropriate. Thank you. We go back. And next we're going to be looking at the walking on toes, plantar flexion on toes, and then back, and then on heels, dorsiflexion. Heels. Perfect. So that is appropriate. Next, we're going to do the Romberg test. I'm going to have you stand with your eyes closed. For about 20 seconds. I don't see any swinging or anything like that. The patient is standing appropriately and the stance is appropriate as well. I did forget one, the tricep. So I'm going to go back to that, the tricep reflex. So we're going to finish up on that. Go ahead and sit back, please. And then we're going to just have your change position here. No. Okay. And then same thing here. Okay, so bilaterally straight grade of 2. That will conclude on my assessment. Thank you.